There is another test that you can do that also can test the acid pH. However, it is typically over the past few years, it's kind of fallen out of favor because of the inconvenience of it. So this test is done kind of in the same way, meaning that this test has the ability to test pH. So what this one is we place a tube in the nose. It's more like a wire. It's a very thin tube. This one is a 24-hour acid pH test. So with this, we place the tube in the nose. The tube has that pH sensor on it. You do still go home with a little recorder, but essentially what's going to happen is you're going to be wearing that tube taped into your nose for 24 hours. Now, most people don't like having to wear that tube home, so they try to avoid that because you do have to wear it for 24 hours, and you also go home with a recorder for that time to monitor and record any symptoms. And then typically patients that would need to have that tube rather than the capsule, those patients are going to be patients who have had a previous gastric bypass, who have a pacemaker, who are on any blood thinners. All of those things are contraindications to having the capsule. The other thing would be any history of like Crohn's or ulcerative colitis with any stricture in the intestines, because once that capsule falls off, which it falls off in about 5 to 7 days after we place it, but once it falls off, you have to pass it through your stool. And so if you have a stricture in there, we want to avoid placing that. So these are two options that a gastroenterologist might suggest to try to determine how often and how much you're having reflux happening. And this can really guide and show us what we need to do next for treatment options.